Hey, caregiver family, Chris Campbell here, founder and owner of Care Reps. And what I wanted to do today was talk to you a bit about the COVID-19 vaccines that are coming out, specifically taking a look at the fact sheets. I got my hands on the fact sheets from both vaccines that have been distributed. Appears as though there are two different vaccines that are being distributed, one from Pfizer and the other from Moderna. So Moderna, Moderna. Sorry about that. But so there are two vaccines out, and it appears as though they appear to be relatively the same from reading the fact sheet. The big difference seems to be that with Moderna's, you have to go, it's two doses, and you have to go 4 weeks apart versus Pfizer, which is 3 weeks apart. So what I wanted to do was for you was to go through the fact sheet here, and there was some. I went through them, and I'm going to take a look at Moderna's and go through that with you, or just point out a few things with you because I found some interesting things on there. And again, basically, this is just to make sure that and to keep you informed about whether you're making the decision to take the vaccine or not. I know that there was some doubts about whether you may want to take it or some skepticism about it. So I just want to go through some of the facts with you on the fact sheet, just so that you're armed and that you can make a decision on whether you want to take it or not. So let me go ahead and pull this up here. One of the interesting things that I saw here now, when your whether you be your facility or your home care agency uh, administer this to you, they are required to give you this fact sheet. So I'll actually post it up on my link here, whether however you found me on social or I texted it to you. Look in the profile and I'll look if I have links to it. If not, you can always just shoot me a text. Text me and I will go ahead and shoot it on over to you. My number 973-798-8997. But I'll give you that again later. But interesting things here that I wanted to read. So anybody administering this has to tell you these things, and it's 4 points that that they're supposed to mention to you. And I'll just read them here. The FDA has authorized the emergency use of the Moderna COVID-19 vaccine, which is not an FDA-approved vaccine. The recipient or their caregiver has the option to accept or refuse the Moderna COVID-19 vaccine. The significant known and potential risks and benefits of the Moderna COVID-19 vaccine, and the extent to which such risks and benefits are unknown. And lastly, information about available alternative vaccines and the risks and benefits of those alternatives. So those are things that they have to tell you. Now, two interesting things that stood out to me was that, um, and I didn't know this until I read it, was the fact that it's authorized for emergency use. Same thing with the other vaccine as well, Pfizer. So it's not an officially FDA approved vaccine. It's just been authorized for emergency use. So the fact sheet actually goes into a little more detail here as far as what exactly is emergency use. So here's another paragraph that they have towards in the fact sheet that explains this. The Moderna COVID 19 vaccine has not undergone the same type of review as an FDA approved or cleared product. FDA may issue an EUA, emergency use authorization, when certain criteria are met, which includes that there are no adequate, approved, and available alternatives. In addition, the FDA decision is based on the totality of the scientific evidence available showing that the product may be effective to prevent COVID 19 during the COVID 19 pandemic, and that the known and potential benefits of the product outweigh the known and potential risk of the product. So there you have it. So it's basically explaining to you that it has not undergone the rigors of a fully FDA approved drug. So again, just so that you have that tidbit of information. Other things here that I just wanted to point out that you may want to take into consideration. It also mentions that you should let the person know, guess the person giving you the vaccine, if you have the following conditions upon taking it. If you have any allergies, if you have a fever, have a bleeding disorder, or on a blood thinner, are compromised or on a medicine that affects your immune system, are pregnant or plan to become pregnant, are breastfeeding, or have received another COVID-19 vaccine. So this appears that it's saying that it doesn't say not to take it, but it sounds like you probably need to get more of a medical opinion if any of these apply to you. But it does flat out and also say later on here that you should not get it to take the vaccine if you have either A, had a severe allergic reaction after a previous dose of this vaccine, or had a severe allergic reaction to any ingredient of this vaccine. The ingredients are listed in this fact sheet as well. I'm not going to get into that now, but just understand that those are the precautions that are in this fact sheet. So again, I just wanted to arm you with that information. Um, your provider or your employer should be, or anywhere that where you go to get this vaccine, should provide you with this so that you can have a copy of it. Again, this is from Moderna, but I went through the Pfizer fact sheet as well, and it really appears to be a lot of the same information. It's not really much different. The biggest difference that I saw was that, again, you have to go to get the Pfizer vaccine 3 weeks apart versus the Moderna vaccine, which is 4 weeks apart. So that seems to be the biggest difference. But either way, with either one that you do, you have to take 2 doses. So that's it for now. Again, if you received this message through a text that we had sent, I think we had asked for you to either complete the information or update your schedule so that we can go ahead and find jobs for you that that fills your schedule. Or if you haven't, feel free to reach out in the links below, or just text me for additional information. Or if you're interested in joining us, 973-798-8997. Or again, just you can link with us through whichever social media network that you obtain this through. All right. Have a good day, everyone. Talk soon. Bye.